All right. Good evening, ladies and gentlemen. My name is Sean Brewer. I am your physical therapy application coach. And tonight I have the great and such fun opportunity to reconnect with one of my favorite applicants from a couple years ago, the lovely Gal. Gal, how are you doing?
I'm good. How are you?
Good, good. And Gal, tell people a little bit about you. Right now you're a student physical therapist. Where are you at in schooling? And maybe kind of jog people's memory about just a little bit about your background, and then we'll take it from there.
Yeah, so I actually started working with Sean 2021, year 2021, right but when I was starting to apply to physical therapy schools, and I just wanted to like reach out, get some advice, how to navigate the process, and Sean really helped me along the way and figure out all the steps, whether it was how I wanted to portray myself in the applications or advice on interviews. He was just there for me throughout the whole way. Right now, I'm currently on my clinical rotations and I'm currently on my last one. And I'm going to be graduating in May and taking the boards in July.
God, that's so crazy. I can't believe that was 2021. But
Hmm.
here we are in 2024, and this whole new crop of people are coming up. So let's talk about when you started PT school. And a lot of pre-PTs, as they go into PT school, are like, how can I be ready? How can I prepare? What tips or tricks or advice or things that maybe you're like, you know what, my first semester I could have done this a little different. What do you think?
I think that a lot of people spend time trying to think what they should do to prep for PT school when honestly, your first semester, they are going to teach you all the foundation that you need to know moving forward. I think my best advice is just to really stay on top of everything. It is very intimidating, it's a lot of information, but just give yourself some grace and just make sure that you're on top of it, always reviewing. And make friends, especially the first semester, like especially myself. I befriended a lot of my friends that I'm still very close with now that have been with me throughout every step of the way. And some topics that I wasn't strong in, they were able to teach me. And just even talking out loud and studying in a group setting was very different for me, but I found that very beneficial. So definitely make friends with your classmates. You're going to be with each other every single day for 2 years. So biggest advice.
That I think the kind of big nuggets from that would be organized, which
Mhm.
I think most pre-PTs fall in that category. But if you struggle with that, like, here's your reminder, like, find a way to get yourself organized. And then I love the make good relationships with your classmates, learn how to do study groups, because I agree. That was my biggest takeaway as well as first couple semesters. Was I went from like being a very independent studier to needing to rely on my classmates. And then also like learning how to study in the lab instead of like just in the library. You know what I mean? Like those
Mhm.
practical skills. So I love that. I think that's if you get nothing else out of this, if you're a pre-PT getting ready to go into PT school, um, plan out your semesters and make sure you've got a good support group and a good study group and people that you jive with. I remember those first few weeks, I kind of bounced around to a few different study groups and we would invite different people to ours. Not as like a clicky thing, but there's sometimes just like there's certain personalities that you jive with better than others, and you're like,
Exactly.
what? I can work really well, and that may change throughout different classes and different things like that. But find your little tribe and start studying. So I love that.
Mhm.
That's great. Okay, so now let's fast forward a little bit. Well, maybe I'll ask this question. What do you feel like was the hardest semester of your like didactic learning in school before you got out on rotations? And why was
Um, Maybe the second to last semester, it covered our last orthopedic course. We also had a course that kind of just combined all of the topics that we've ever learned in PT school. We also started neuro, so it was just a lot of heavy subjects that kind of relied of like everything we've ever learned in PT school and applying it.
Mhm.
So yeah, that was definitely one of the hardest semesters.
For sure. So just kind of putting everything all together, which
Hmm.
that's what school's for to help you kind of get a framework for that. But yeah, and you just kind of have to you just have to go through it. And I always talk to people and they're like, is PT school hard? And I'm like, yes, but would you want it to be easy? You know, I don't know. I didn't I wouldn't feel very satisfied or feel very competent in myself if it was just like a cakewalk to go through
Hmm.
PT school. So
I agree.
hey, if it's hard, it's okay if you're like, I don't know if you're gonna make it. Just hang in there and keep on going. But thank you. Thank you for sharing that. I think it's good for people to be like, it's not just the first semester when you kind of get your feet wet. Um, there's still going to be periods of time when it's more challenging than others for you. So cool.
Yeah, definitely every semester has its own challenges in different ways. So it's just about how you handle it and learning how to like whenever it's like a new subject, like learning it in a different way too.
For sure. For sure. Not
Hmm.
just don't be stagnant in your learning methods. Yeah.
Hmm.
Cool. So now let's talk about, let's kind of pivot a little bit and talk about when you left the classroom and you went on to clinicals, right? And you got your big girl pants on. So talk about that transition. How was it? What did you learn from that first rotation? And maybe talk us through the rotations you've been through thus far and what you've learned from those experiences.
So my first rotation, like one of our final rotations, it was a 10-week rotation. It was an outpatient orthopedic. That rotation was very much, I got to see a mix of patient populations from like neuro to ortho to some vestibular, and just all around it was a very broad range of population. So I didn't know what to expect every day, but I thought always having like your mentor there, your CI, and just taking their advice and really putting in the work outside of clinicals do to better prepare you and just put everything together really helped me for that first rotation.
That's
And
great.
then,
Sorry,
yeah, and
going back to that first one. Um, I think a lot of SPTs have anxiety like, do I know everything I need to know going into my rotations? And the answer is no, but
no.
that's okay because even as a clinician, you're gonna have stuff that you're gonna do an evaluation on a patient and you're gonna be like, I need to go look at some stuff because it's been a
Hmm.
while and maybe it's a diagnosis you haven't seen before.
Hmm.
And that's not to say like you're not capable of helping that person. You just need to go like refresh some things and get your ideas put together. So don't feel like you have to have it all figured out when you're going into that first rotation. It's you're there to learn. You're not there to be perfect. So sorry, go ahead. I just wanted to kind of
Yeah, of course. Of
point.
course. And then the second rotation, it was acute care. So I was in actually a level one trauma hospital.
Nice.
So that was a whole learning curve as well because they do teach you extensively about it in school, but it's very hard to replicate that in school in comparison to like orthopedic conditions. But just like the first rotation, you just kind of take every day for what it is and try your best to have your CI guide you and do research outside of the clinicals too.
Awesome. So just um, continued, especially, I mean, I knew I didn't want to go into acute care when I went into PT school, and I was just kind of like ready to get that rotation over with. But it is important, and I learned a ton. Like you get to see kind of, it's good to see the healthcare system from the beginning of when they start care. And then when you go to outpatient, you have a much better idea of like what the patient's been through and kind of what to expect with them as they're coming into those outpatient clinics.
Definitely. And now my third one is also completely different. It's my specialty rotation in women's health and pelvic floor. So for this rotation, I actually had to take a certification course prior to starting. So it was my level one pelvic floor course. So right now I'm in my second week, so I'm just kind of getting into like the swing of things, and I kind of take my experiences from all the other rotations, just kind of learn as you go, have your mentors guide you, and just put in a lot of work outside of your clinical hours too.
That's awesome. What made you know that, when did you know that you wanted to do some type of specialty in pelvic floor women's health?
So For women's health, I actually had like personal experiences with my own like friends growing up that went to like a pelvic floor PT, which was very uncommon.
Yeah.
And in school, I very much liked all the orthopedic conditions. And once we started learning more about it in school, I actually did like a case study on a research article, and it showed me the effects of like pelvic rehab and orthopedic conditions together. So I
Hmm.
really like that approach about seeing it from that perspective and being able to use that specialty to also treat orthopedic conditions as well.
Cool. Yeah. So, um, one thing that I think is really good is that you're not trying to pigeonhole yourself. You're just trying to
Mhm.
like, I don't know, you're trying to add more tools to your tool belt instead of saying, no, I'm only going to do ortho or I'm only going to do women's health. Like you're going to combine the two skill sets because like your pelvic floor patients still have muscles and bones and joints, and all of your ortho patients still have pelvic floors, right? So if it's kind of like um, there's a lot of patients that we work with that they'll come in and they have complaints of like vestibular symptoms, but they're coming in for something else, like they have knee problems. But you still want to be able to help them, even
Mhm.
if that's not like directly what they have. But it's just having tools in your tool belt. So I really like that. Instead of saying like, nope, I'm only going to work with these kind of patients, like just broadening your skill set, making yourself as valuable as possible to your patients, and then wherever you decide to go work.
Exactly. And especially like in any outpatient, like you're going to use neuro principles while treating orthopedic conditions and vice versa. So just expanding your toolbox and using everything you've learned to treat the patient and not focus on just one like disciplinary.
That's awesome. And that's what I mean. Most PT schools, there are applicants will ask us like, I only want to do this type of PT, right?
Mhm.
Say, okay, that's fine. You're more than welcome to pursue that. But PT schools in general, their job is to graduate you as a generalist, right? Like you have a good idea of everything, and then you're gonna have your little niche that you want to fall into. Um, and you can do Con Ed that gets you to that specific area, like you're already doing with your pelvic floor certification. Or if you really want to, you can pursue a residency if that's something you feel like you is going to validate you. But you don't have to do that in order to be able to treat
Mhm.
patients. I think um, you're a testament to that. Like, I don't know, do you want to go on and do like a women's health certification, or you're like, I'm just going to do, continue to do, well, what is that? The women's health, or is it pelvic floor
It
specialty certification residency?
I'm pretty sure it's the WCS
That's
exam.
that's it.
Yeah. Hmm.
Do you want to do that? Or you're like, you know what? I'm just going to continue to do these other pelvic floor certifications, which can still provide you a lot of similar skill set.
So ideally, right, after graduation boards, I would love to expand and like keep building up my toolbox in like the orthopedic conditions realm and be able to treat pelvic floor patients at the same time. So to do a little bit of both.
For sure. For sure.
Mhm.
Cool. Cool. Um, so you've got another 8 weeks in that rotation, and then it'll be May by that time, which is weird to
Mhm.
think of that. And are
Mhm.
you so excited to graduate and to get back together with all your classmates again?
Oh, I'm so excited. I'm so excited for to finish my rotation and graduate and be on my own soon.
Yeah. Yeah. And then you said July is when you're going to take the boards. How
Mhm.
are you feeling about that? Have you started to do? I know, like before we jumped on the call, we talked a little bit about the prep work that you're doing, but give some of the listeners an idea of what you're doing to kind of get yourself ready for your big day with taking your
Mhm.
licensure examination.
So my program actually does like a very good job at having like a boards course, kind of like a wrap-up course throughout our clinicals. Like we even started it right during my first clinicals where we still keep up with boards prep and we meet like once every 2 weeks, once a month on Zoom to just review important concepts, which I feel like is very beneficial for me because I always like to be reviewing just like a little bit here and there, just so once we do finish with rotations and it's like, oh my God, we have to study all of our coursework for one exam, I feel like it kind of takes the load a bit off. and helps us just have a very good foundation from when we do study for the boards.
For sure. For sure. And that's great. I think that we've talked about it here at Physical Therapy Application Coach forever is you're going to PT school, your goal is to get your license. That's the whole point of PT school. Otherwise, if you just learn a bunch of cool stuff but you don't have a license, then want,
Mhm.
right? So I think it's great if as you it may seem far away for pre-PTs, but knowing ahead of time, like what do you do to help your students prep for the boards and like what things do they have additional resources and do they have stuff in place to help you be prepared and to be ready? And the schools that do really well on the licensure examination for first time pass rate, it's not by accident. Like they do things throughout the program to get you ready. And I think it's great that once you leave the classroom, they don't want you to just brain dump everything and like learn what you're learning in that specific rotation, but try to keep it fresh. Because you still need to keep it all in there for the next few months.
Exactly.
Yeah. Yeah. Um, so what in terms of as you get ready to step into that preparation phase, what is your general plan of how you're going to go about prepping for the licensure examination, besides doing like your Zoom meetings with your classmates?
So, the course that we're in, we have full access to it for a whole year, and I'm gonna do that. We also have a book called Score Builders that we're using in our program. I was also on the fundraising committee for my SJ, so we raised money to get us the Score Builders book, flashcards, and basically all those resources that we have. So when the time comes, we can start prepping.
Awesome. Awesome. That's great. So you got multiple different avenues of things to study. And like we talked about, we continue to harp on whether it's the ACT, the GRE, the MPTE, any of those standardized tests, the most success you're going to have is taking those practice tests, seeing where you need to work on stuff, going back and revisiting those areas that are most important, that are like the majority of the tests. And I think also just understanding like what is the general makeup of the test? How many questions are you going to have from each area? So you know how to budget your time and to maximize your time with studying and then once you get into that, it's not as overwhelming because you'll remember a lot more than you probably think you will because there'll be stuff that comes up and you're like, oh yeah, I remember this, even though it's a topic that you learned about months ago or maybe even years ago. But it's still in there because you're using that information. It's just presented in a different way. So I think once you get in and you've got the practice tests, then you have a better idea of like, this is where I actually stand. This is what I actually know instead of just being trapped in your own head and being like, oh, I know I need to study and I can't take a test until I know more. Like just get in there and get your hands dirty and figure out where you're at.
Exactly. And they even recommend like while you're solely just studying for the boards, like 12 weeks before the actual exam to take a full length practice exam every like 2 weeks
Hmm.
to just see where you're at, where you need to go back to as well. And also all your clinical experiences really do reinforce major concepts that you will see on the boards. So that's why I was stressing heavily just if there's time like outside of the clinical work to just go back refresh, not only for the clinical experience, but for the board exam.
That's a great point. I specifically remember with like my acute care rotation, I was like, okay, I'm just gonna be done with this. And then as soon as I was like getting closer, I was studying and I was reviewing stuff, and I was like, hey, you're gonna be asked stuff like about this on the boards. So there's no like waste of time. It all is contributing towards you getting to that end goal of getting your license. And then once you have your license, then you can go off and you can not brain dump, but you're gonna specialize. You're gonna find more of your lane that you're gonna stay in and you'll have more of that material top of mind. And there may be other stuff that you're going to have to go back and review if it comes up and you're like, whoa, this is a crazy neuro diagnosis that I haven't really, I haven't seen since school. I need to go back and just revisit how to go about this. And that's totally fine. That's a part of being a professional is admitting when you need to go back and get more information. And if you can work on it, great. If you need to refer out, that's still a part of your skill set as well, is you don't have to know everything all the time in order to be a good provider. Yeah,
Exactly.
cool. Well, Gal, thank you so much for giving us this time to pick your brain and to see a little bit more of a window into what it's like to be at this end stage, your final rotation before you take the boards. And then I would love to once you've got your license in hand and you're kind of figuring out where you're going to go work, love to do another catch-up video and just kind of see that full life cycle of like, okay, now you're done school's in your rearview mirror and it's time to move on and to be a professional. So we'll definitely reach out and keep tabs on you and excited to see where you end up.
That sounds awesome. I'm looking forward to it.
Okay. Thanks, Gal. Take care and best of luck with getting everything done with school.
Thank you.